Today, we're talking about long COVID and a few new resources. A little bit of review, but mostly some new resources that could be helpful. Long COVID, it really starts after 4 weeks after getting the COVID illness. So not 4 weeks after you've gotten better from COVID. It is really 4 weeks from when you tested positive. For COVID, you get exposed. It takes about a week or two to actually start developing symptoms. And then after that, you may start getting a positive result after 1 to 2 weeks, and then the infection and the symptoms. And then 4 weeks after that, like within that month, you can still have some lingering symptoms even after 2 weeks. And then if you're still having symptoms after a whole month of getting COVID, then that's considered long COVID. It's really a wide range of different problems. It doesn't necessarily look like the initial COVID symptoms that you had. They can range from mild to very severe. It's estimated that 5 to 30% of people who had COVID developed long COVID. Now they're saying 1 in 3 adults in New York City specifically who have had COVID-19 will start experiencing long COVID. So long-term physical or mental health effects from COVID. The common symptoms we know are fatigue, brain fog, malaise, getting more tired quickly after working out, headaches, tremor and palpitations is another one, feeling dizzy and some muscle pain. Those are the most common ones. There are more than 200 symptoms. So if there's something new that started during the COVID infection, and may be due to long COVID. 1 in 5 adults, their health condition or having these symptoms may be related to COVID-19. The symptoms, dizziness, fatigue, headaches, also long-standing issues with taste or smell. People also get constipation, diarrhea, and sleep issues. Memory changes is a huge one. Coughing and feeling short of breath, especially after working out. And then always feeling really tired and having mood changes like anxiety or depression. Initially differentiating this from long COVID versus like how COVID has impacted mental health overall. That is still hard to distinguish, but how we can approach keeping track of our symptoms and advocating for ourselves with doctors so that we know that we're getting evaluated appropriately for differentiating what could be the causes. Sometimes there is not going to be a very clear cause, unfortunately, but you want to be able to know your diagnosis and feel valid on whether this is something that may be related to other things in your life around COVID affecting a lot of things versus it actually affecting the physiology and your mood, which it can also be doing. So who's at risk? It's adults and children. We're seeing a lot more children get long COVID too, but it is most common in adults, especially adults aged 35 to 49 have the highest rates. And that may just be the population level because it is higher. There is a higher risk if you are over the age of 65 of getting long COVID. There's a higher risk if you had severe COVID, if you're in the hospital for COVID, but really even if you had mild COVID, you could still get long COVID. And then underlying health conditions can put you more at risk for long COVID as well, especially diabetes, asthma, and obesity they found can really put you at risk for long COVID. The biggest one we want everyone to be aware about is being unvaccinated for COVID. Not getting the updated boosters could really put you at risk for long COVID. Women and Black and Latinx population are also the highest risk. So something to be aware about of why a lot of people are getting long COVID in our communities and what we can do about it. So we really don't know that much about long COVID and how it's started, and there's still research ongoing about it, but really unknown on why it's continuing. Some of the theories have been that there is a lingering COVID virus, not enough that you can infect other people, but enough in your body that's there. And then the reactivation of a latent virus like COVID-19, like it dies in your body, but it's like remnants may still be in the body and then get reactivated a little bit at a later time. And then an autoimmune response. So COVID-19 happened, and then as COVID-19 leaves your body, better from the acute infection, your body may boost this extra immune response with soldiers that end up hurting its own body a little bit. Then organ damage is another one, which seems like it's a little less likely. There's been evidence that there's not a lot direct organ damage that is being caused by the COVID-19 virus long term, but it may be more organ damage during the initial infection, hurt certain parts of your body. But this doesn't fully explain a lot of it because some people will initially have acute infection of just coughing and tiredness, and then they have like long-term infection of stomach aches or something. Like sometimes it's not always fully related, but oftentimes it is similar to your acute infection that's long-standing. So that could be evidence of there being some organ damage. There's not a single test for diagnosing diagnosing it, unfortunately. It's based on your history of COVID-19 and excluding other causes that may be causing whatever symptoms you're experiencing. And those are important things. Sometimes doctors are rude about it and gaslighting about your symptoms and evaluate other things. The reality is that we actually do need to evaluate other things because those are easier things to rule out to make sure it's not pneumonia or other things that you may be saying, I know it's not pneumonia, but unless you have tests from your past records that you've seen from your other doctors, the doctor doesn't know whether or not you have been tested for it. Or the higher ups need to see that we are doing our due diligence of checking everything and making sure there's not anything else serious going on. Your doctor may do more, it's really assessing your symptoms and your story, and then also seeing how your symptoms, like what they look like right now, and whether there is imaging or testing, like blood tests, urine tests, usually less likely urine tests for long COVID stuff, but it could include all sorts of tests for figuring out what might be the reason, if there is another underlying reason other than COVID. And if nothing else is explaining it, then it is likely long COVID. And then in terms of how we treat it, there's no direct medication for long COVID, unfortunately, but what is really important and what people often forget is true treatment and true rehabilitation of your body is physical therapy, doing counseling, doing memory exercises, olfactory training. People can go from not being able to smell anything to being able to smell everything just from olfactory training. That just shows how your body, when you work with it and do some of these exercises and trainings with professionals, it really changes your physiology. It's a real medication. So just remembering that when your doctor sends you to physical therapy for any reason, including long COVID or otherwise, those are real exercises that really can change your body and strengthen up different areas. That's often the hugest way to really improve for long COVID when we don't have medication. Sometimes we do want to do physical therapy for certain problems versus going to medication, because sometimes medication for certain things is not really foolproof or perfect. Not saying all physical exercises are. This is why even in physical therapy, you need to vocalize like what you're feeling and what feels right and what feels wrong, what you got out of the session, so that your physical therapist can keep catering it to your body and mind, because there's not mind readers and everybody's body is different. So really vocalizing what your needs are, but physical therapy can be very transformative in your care when you work with people. And then also doing pulmonary rehabilitation, cardiac and neurologic rehabilitation. The neurologic rehabilitation often includes memory exercises, but also a lot of other different exercises. Cardiac rehabilitation also has very specific exercises based on what cardiac disease you may be having. It's things that people study for years of different ways that we can rehabilitate the body. And then medication for symptoms. So for headaches, that's something harder that you can't really do physical therapy for. And there's other ways you want to approach headaches of thinking about diet that may be making it worse or better and all of that, but maybe taking Tylenol to help those symptoms. The medications, they don't cure the symptoms, but they may help you feel better. A reminder that if you haven't gotten a vaccine for COVID since September, you are due for one, whether or not you're 65. If you did get an initial vaccine for COVID for the booster from 2025, if you're over 65, you could get a second booster. And I recommend doing that. That's a really good practice to do. So if you are over 65 and you already got a booster since September, but you only got one booster, you can get a second one as well. Remembering good hygiene, hand washing, masks in the subway, sanitizer. There's a lot more people out and a lot more tourists coming into the city. So wearing masks on the subway, especially if you're higher risk, if you're over the age of 65, I really do recommend. Then doing precautions if you have a viral cold, like making sure if you live with other people that you have them sanitize around you and that they're using hand sanitizer, that you're using hand sanitizer when you're touching shared surfaces. And then also trying to not go out as much if you have a viral cold, let your body get better and try not to spread to other people. And then trying to have cleaner air, whether that's when there's better air quality outside, to open a window, to make sure there's fans on in your household, and if you can, have an air purifier. And then decreasing risk factors, working on prevention overall. Like one of the risk factors for long COVID is obesity and diabetes, making sure you're caring about those things in your life too, and approaching those by doing diet and exercise, thinking about different ways you can eat, staying on top of your medication and your doctor's visits. So making sure you're still seeing your doctor very regularly and that you're taking the medication that's needed for your body. Will keep your body in better shape so that if you do come across COVID, that hopefully it'll heal better and that your body won't develop long COVID from that. So post-COVID care clinics at Mount Sinai, these are the numbers that you can call to make appointments with them. them. And if you're having trouble coming across or getting appointments with them, you could also look at the New York City Health and Hospitals COVID centers as well. One's in the Bronx, one's in Jackson Heights. If you call this number looking for COVID support and wondering where to start, this will help you get connected to the same clinics there. This will also help you get connected with the representative to talk about your symptoms too and see if you do qualify for the long COVID clinics. Going off of some of these from the New York City Health and Hospitals information, they've also given a really good pamphlet on how to keep track of your symptoms and what to talk about with your doctor. It's a good resource and a good practice for a lot of things within healthcare. You want to come to your doctor's visit prepared on the things you want to talk about because there's such limited time with doctors. You want to list it in priority from highest priority to lowest priority and then really know your story for each of them. For the first thing for long COVID, you want to be able to know how often your symptoms are happening or if they go away and then come back or they never went away. So some people with long COVID will be fine for a few months and then maybe start feeling some symptoms after. And that could still be from long COVID. And so you say they've come back or they never went away. And then how severe are your symptoms? Are they mild? Are they moderate? Are they severe? If you have gotten vaccinated, did your symptoms get better, worse, stay the same after getting vaccinated? And then your ongoing symptoms, you check them off here, whatever you've been feeling that's related to long COVID. If you're feeling one of these that's not related, don't include it here. You can maybe write it on the side or something. That really big tips for when you're preparing for your medical appointment, knowing all of your symptoms, the timeline of your symptoms, whether you had headaches at first and then the headaches never resolved and then you started getting like worse breathing and fatigue after. So you want to write that timeline. And there's also another form for that too. Write down whatever questions you have around long COVID. Make sure you keep track of that too. It's really good to be able to bring someone with you if you can, to just have someone else there as your advocate, also just someone else that can ask any questions as well. Make sure you write out your COVID story. You write out exactly the timeline of what you've been experiencing. And if you've had any other results, the positive COVID test, all of that, make sure you bring those results in. If you have MyChart, it's a MyChart application or My Mount Sinai, it's an application on your phone. Often see your own records, so you can just peruse that and look at your old records, and you can see some records from all different hospitals. If you're not seeing something from a hospital that you went to or a clinic that you went to, you should call up that clinic, tell them to fax it to your primary care doctor. You can always look up your primary care doctor's fax on Google or on My Mount Sinai or MyChart application should have it too. But you want your doctor to have all of your information and for you to also have all your information. So even if you have them mail it to you, making sure you bring that in to your doctor's appointment. Have a separate folder in your apartment for all of your medical stuff so that you keep track of it and you bring it to your doctor's appointments. And that's all of your doctor's appointments. If you see a primary care doctor, then you also see a heart doctor, diabetes doctor. It's just good practice to bring everything. If this is your first time making sure that all the files are there, you can bring it to your doctor and say, I'm bringing all my past files. I just want to make sure you have it all. And then you just give it to them and they can sift through and see what things they might want to scan into their chart. But that's a good practice to do so that we have all the information. So all of the results, especially recent results of anything, of chest x-rays, of EKGs, which are the heart electrodes that they put on you, any other test result or lab result, blood results, urine result you want to bring. And then prepare a list of information. If you need disability, you want to be able to tell that to your doctor, look up any forms that you might need for work. Doctors often have access to those too, especially if you can see it on Google, but just writing out what you need from that appointment. Then during your appointment, doctors are always typing on the computer while you're talking. You can also write down stuff too so that you can keep track of what you talked about. So don't feel hesitant about doing that. It's whatever you feel comfortable with. And then make sure you're clear with the action plan of what the plan is with the doctor. During your appointment, if you are feeling uncomfortable about recommendations, you can ask for a copy of your medical record. You can also probably access it on My Mount Sinai or MyChart app. Then telling your doctor like what documents you need for your disability. And if they're not filling it, which would be really odd, those are signs that maybe you do want to find a different doctor or just try to push back with them. But the doctor should be, especially if you are experiencing a debilitating disability from long COVID and you've been evaluated for it before, then they really should be writing a disability form for you. But sometimes if it's like your first time getting evaluated for long COVID, you may need to go through a round of physical therapy before we're allowed to actually write that. Ask for copies of any referrals if you want. It's a good practice to just have copies of your referrals. Usually that's included in a printout that the doctor gives you at the end with an after visit summary that shows all of your new medications, any referrals. It doesn't necessarily show whether or not they did the disability form in that, making sure that you have a printout of that. Then after your appointment, making sure you're scheduling your next appointments, seeing a doctor doctor isn't just a one and done thing. You always want to be consistent with seeing your doctors. And you pick up your prescriptions, you start taking those and stay on top of it, taking it every day, and then continuing to track your symptoms. It's okay to get a second opinion. So if you really are feeling like you want a second opinion, you can always ask your clinician to see another primary care provider, and then submit any paperwork you need for your disability benefits or workplace accommodation. This is a good form for tracking your symptoms, and you can always retroactively write, even if you don't know the exact date, but like generally thinking about when your COVID symptoms started or when your long COVID symptoms started. I think it was like last May to August, I felt this symptom and it lasted for this long, and being able to at least estimate and give like a good idea of what your COVID story is and when you experienced what. Also including when your initial COVID illness was and what you experienced then too. So that's a good way for us to see what all you're experiencing. As we know about long COVID, there's so many different symptoms, and we know that the biggest risk is people who haven't received the vaccine. So really making sure you're on top of the vaccines and follow all the other prevention things we talked about. As a reminder, get the new booster like we talked about. The flu shot is not available right now, but keep an eye on that. Once it comes to September time, start thinking about your flu shot. If you go to the pharmacy, just ask them about it if it's available, because you want to be on top of your yearly flu shot as well. Then making sure you got your one shot of the RSV. These 4 vaccines are so important, especially if you're over the age of 60, to be getting, to avoid all of these. They often interact with each other. So you can have really bad COVID and then you could get pneumonia on top of it. So really getting vaccinated for everything is so important. The pneumonia vaccine, if you're over the age of 65, you should have gotten it. Make sure you ask your doctor about that. Other vaccines are not related to respiratory illness. Making sure you get your shingles vaccine when you're over the age of 50. Your HPV vaccine you can still get if you're younger than 45. And then the tetanus vaccine you need to get every 10 years if you are higher sexual risk or inject drugs. The monkeypox vaccine, the Hep A and Hep B vaccine you need to get. Another thing, you should always have a record of your childhood vaccines and your titers. So making sure you get a printout of that from your doctor or ask them, because oftentimes workplaces will ask for these. So these are all the vaccines that you should have gotten as a kid. And if you are unsure, there's titers for most of these that you can see what you have had. For your shots, for like shingles vaccine, going to Duane Reade or CVS and other places, you can go to your actual doctor, your healthcare provider, and these other centers. You do have to establish care at Settlement Health and New York City Health and Hospitals and Berecan Neighborhood Health Center to actually get vaccines with them. If you're sick, these are places that you want to reach out to as well. Again, through that MyChart app and the My Mount Sinai app, you can message your doctor directly through that.
What is the treatment for long COVID and forgetfulness, the memory problems that come with it? You had mentioned something about memory exercises. Are there other things, or is that the main treatment?
That is the main thing, unfortunately. And memory exercises are all sorts of ranges of things. You can look up some memory exercises yourself, but getting your doctor to refer you to a memory specialist so that they can work with you on memory exercises. But unfortunately, there's no other real direct treatment for memory issues. And that's the same thing even as you get older and there's other non-long COVID related memory loss. It's not really perfect medications for memory loss. So a lot of it is really training and exercising our brain. That's also a muscle and needs that exercise too. But with memory rehab, you can really start noticing some differences too. No direct medication for it.
The memory exercises are very real treatment too. Good reminder that your brain is a muscle. It needs working out too. Memory games and puzzles and word puzzles.
For long-term memory, making sure you think about or try to write out some memories from your childhood. Sometimes it could trigger traumatic things. That's also something to really assess therapist.
Differently.
But you do want to be helping remember some things from your past as you get older too. So that can build up and refire certain parts of your brain and strengthen that memory.
When is the next dose of the COVID vaccine going to be available? We don't know yet.
It'll probably be in the fall, but making sure if you are over 65, you can get the newest booster that was available since October of last year. If you're all up to date, then just keep your ear out about the flu and COVID vaccine that usually start around September. There'll likely be new news about it.